Let's check in again with infectious disease specialist Dr. Zain Chagla with the latest developments of COVID-19. Good to see you.
Hi, Bob. How are you?
Good, good. We've got the numbers starting to go the right way with cases, but what's your thoughts on opening schools or fears?
Yeah, I mean, it's tough. I mean, I think things are going in the right direction. We still want a cool-off period. I think most of the chains of transmission have ended in children because they've been at home for the last couple of months, or at least the last month. It's going to be something that needs to be watched. I think the districts that are opening up now, we really can take a good look at it, whether or not they drive their community's transmission. But I think, schools are important, and hopefully we set a set deadline for it to open up rather than kicking it down the road. And I think Sick Kids came out with a report yesterday saying pick a date and do it because, again, it's the first thing that needs to be open as part of our society, and it has such a value to kids as well.
Yeah. All the efficacy rates of these vaccines, most of them, around the 95% point in clinical trials. And I remember you mentioning a while back, that's clinical trials, but real world, something a little less. But there's news out of Israel suggesting only about a third of elderly saw lowered infections with the first dose of Pfizer vaccine.
Yeah, so this is population-based, right? So, the people in the clinical trials, we study them as a single entity for their symptoms. We don't really study transmission person to person. Again, the outcomes in the clinical trial were symptomatic COVID-19. Add to that, again, this is first dose. So, at the first dose, it got between 50 to 90% by that day 21. We don't know how long that lasts. And so, I think the Israel experiment is going to be super interesting. I think the world is watching to see what these vaccines do in a real life, real population. But it's a little bit too early to draw the conclusions that the vaccine has lower efficacy yet. It's the point in time, it's the burden of disease around them that really defines what's happening. It's going to be interesting to see once they get their full dose, what that means for that population moving forward. If they're not showing up to hospital, if they're not represented on the wards and in the ICUs, then we have a good sign that this is actually a very effective vaccine.
Okay, let's talk about the variants that are rolling around. Is there a variant that's keeping you up at night?
Yeah, there's a couple. The one from South Africa and also seen in Brazil has a mutation that might make antibody levels less effective. Now, it doesn't necessarily say that we won't make a good immune response. It just says the way we make antibodies may not be perfect against this. The UK variant, I think we're seeing show up in many parts of the world, and now data from Portugal, Denmark that it's replaced, and maybe data from us to say that it may have caused a long-term care outbreak. And so, these are going to be a part of our future, unfortunately, and they're very well could be a variant that just arrives generally in Canada as well. It is, a race against getting people vaccinated, even if these variants lower immune response or lower the ability for us to fight them within, people that are prior infected. It still has a big value here as a baseline. But I also think in the long term, we may need to start talking about developing a secondary vaccine to deal with these as time goes on, as they may be the predominant circulating strain. And the nice thing about Pfizer and Moderna is that they can be changed relatively quickly. And I believe some of that work is even being looked to right now in terms of, generating a new vaccine should we need it.
Well, that's good. With these vaccines, will we need a booster? Like an annual shot?
I mean, this might be it, right? Like, it may not be that you need a new immune response, but you need to kind of have some extra tools to fight the variants that are out there. So, maybe in a year or two, we get another shot that has some of these variants enclosed so that you get disease activity under control again. I don't think you'll need a response to get another, to boost your immune system. But again, it's just to give it some more tools to fight what's out there right now.
Yeah. Are we screening enough in Canada for these variants?
It is escalating. The capacity from the province, I think, is going to be about 1,500 a day. There is a concerted effort to see what's going on. So they're doing some work to say on a given day, how much of this is in the variance of a select number of people across all settings. And I think we are pushing as well that many of our outbreaks we're sending off to make sure that they're not expecting it. Again, the Barrie home is one that might be the first, but certainly, yeah, we are starting to look more and more.